Good afternoon, Dennis Hanson. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I have always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
How will you make a positive impact on the nursing profession?
There are different ways to contribute to making a positive impact on the nursing profession. Creating feedback forms helps us secure and promote our jobs and gives us the motivation to work hard. Nurses deserve better working standards and benefits for their hard work. Therefore, listen carefully to what nurses have to say to lighten the workload. Additionally, it provides continuing education for all to make us stay updated and be the best always.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you like most about your profession?
What I like most about my profession as a nurse is the opportunity to make a meaningful difference in people's lives every day. Nursing allows me to provide compassionate care and support to patients during some of their most vulnerable moments. The ability to offer comfort, alleviate pain, and promote healing is incredibly rewarding. Additionally, nursing is a dynamic and ever-evolving field that challenges me to continuously learn and grow. I appreciate the collaborative nature of healthcare, working alongside dedicated professionals to deliver the best possible care. The relationships I build with patients and their families are deeply fulfilling, and knowing that I have positively impacted someone's health and well-being is what drives my passion for nursing.
Your preparation time is over. Please start your OET speaking roleplay.
Hello, I'm Dennis Hanson, one of the nurses here today. I can see you look a little apprehensive. What brings you to the clinic today, and how can I help you?
Hello, Dennis. Yes, I'm here for the COVID-19 vaccination, but I must admit, I'm feeling quite nervous about it. I've heard so many things about the side effects, and it's making me anxious.
Don't worry, I'm here to help. May I know your name, please?
My name is Mihiraa.
I completely understand your concerns, Mihiraa. It's very natural to feel that way when you're facing something new and there's so much information circulating. My aim today is to address all your questions and make sure you feel comfortable and informed before we proceed with anything. We can take our time and go through everything. So, you're here for your COVID-19 vaccination, and you're worried about the side effects, is that right? Can you tell me a little more about what specifically is on your mind regarding them?
Well, yes. I've seen things online, heard stories from friends, people talking about feeling really unwell, like they have the flu for days, or even more serious reactions. It just makes me wonder if it's truly safe, or if I should even bother getting it at all. I mean, what if I get really sick from the vaccine itself?
I hear you, and it's completely understandable to be cautious when there's so much information, and sometimes misinformation, out there. I want to reassure you that the COVID-19 vaccines have been extensively tested through rigorous clinical trials involving thousands of people worldwide. They have also been thoroughly approved by leading health authorities globally, which means they've met strict safety and efficacy standards. The primary goal of these vaccines is to significantly reduce your risk of severe illness, hospitalization, and even death from COVID-19. They offer a very strong layer of protection. What specific information or stories have you heard that are causing you the most worry? Knowing that might help me address them directly for you.
Mostly it's the thought of feeling ill afterwards. I really can't afford to take time off work, and I have a busy schedule. What are these side effects people talk about, really? Are they very severe?
That's a very practical concern, Mihiraa. Let me explain what you might typically expect. The good news is that most side effects from the vaccine are generally mild and don't last very long, usually only a day or two. For instance, you might experience some mild pain or swelling right where you receive the injection in your arm. Beyond the injection site, other common effects can include a headache, some general muscle aches, a feeling of tiredness, or a low-grade fever. It's really important to remember that these common reactions are actually a positive sign. They show that your immune system is actively learning and building its defenses against the virus. When your body encounters the vaccine, it's like it's practicing for the real thing, creating antibodies and memory cells. These temporary symptoms are simply your body's natural response to this practice, indicating that your immune system is successfully responding to the vaccine as it should, preparing you to fight off the actual virus if you encounter it.
Okay, that makes a bit more sense if it means my body is learning. So, is it just one shot, or do I need to come back again?
That's a great question, Mihiraa, and a very important aspect of getting the most out of your vaccination. For full and comprehensive protection against COVID-19, the vaccination schedule typically involves 2 doses. It's really crucial to receive both of these doses because the first dose essentially introduces your immune system to the virus, while the second dose acts as a booster, significantly strengthening and prolonging your body's immune response. This ensures your body builds the most robust and strongest possible immunity to fight off the virus effectively. The typical period between these 2 doses can vary slightly depending on the specific type of vaccine you receive today. For instance, some vaccines might have a shorter interval, while others might recommend a longer one. However, generally, this period ranges from about 3 to 8 weeks. Don't worry about remembering the exact timing for yours. Before you leave today, we'll provide you with a vaccination card that clearly states your specific vaccine type and the recommended interval for your second dose, along with details on how to book it.
2 doses, all right. And what if I do get those side effects you mentioned? What should I do at home to manage them, and when should I actually worry and get help?
That's a very important question, and it's good to be prepared, Mihiraa. Should you experience any of those common, mild side effects like pain at the injection site, a low-grade fever, or general aches and tiredness, the best course of action is to simply rest and allow your body to recover. It's also crucial to ensure you drink plenty of fluids to stay well hydrated, as this can help with any fever or general malaise. For pain or fever, you can comfortably take over-the-counter pain relievers such as paracetamol or acetaminophen, following the dosage instructions on the packet. Most people find these simple measures to be quite sufficient, and their symptoms resolve within a day or two. However, it's equally crucial to know when to seek medical attention, as a small number of people might experience more significant reactions. You should immediately contact emergency services or return to our clinic without delay if you experience any signs of a severe allergic reaction. This would include symptoms like difficulty breathing, swelling of your face or throat, or a widespread rash that appears all over your body. Additionally, even if your symptoms are not an allergic reaction but are persistent, severe, or worsening after a couple of days, it is always best to err on the side of caution and get medical advice to ensure everything is all right.
That sounds manageable. I feel a lot better now that you've explained everything so clearly.
I'm so glad to hear that, Mihiraa. Your understanding and comfort are our top priority. So, just to confirm, do you consent to receive your COVID-19 vaccination today?
Yes, I do. Thank you, Dennis.
Excellent, Mihiraa. We'll just get everything ready for you.